Hi beautiful people, I am Shahan Layek. Welcome back to my channel. And today in this video I will be discussing about Cotard delusion, Cotard syndrome. So what is Cotard syndrome? Basically, let me tell you the history of this syndrome and then I will be telling what it is. So there was a French neurologist, his name was Jules Cotard. His name was Dr. Jules Cotard. And he was in the 19th century, okay? And a patient came to him and her name was Madame Moiseli. And this patient told that she has no brain, she has no nerves, she has no chest, she has no stomach, and she has no intestine. So all these things she complained. So what is she suffering from? She actually believes that she is eternal and she will live forever. So she believes that she is eternal. She is eternal. And she will live forever. She will never ever die. She will never ever die. No death for her. So all these things she was believing. And after some days, she stopped eating food. She stopped eating food. So why did she stop eating food? Because she believed that she don't need food. And ultimately, what happened? Ultimately, she actually died. How did she die? She died of starvation because she has not taken food for so many days. So this is the case history. So there was a patient known as Madame Moiseli. She came to Dr. Jules Cotard, who was a French neurologist in the 19th century, and she told that she has no brain, no nerves, no chest, no stomach, no intestine. She also firmly believed that she was eternal and would live forever. She don't need to eat, and ultimately she died of the starvation. So what is the syndrome she was suffering from? She was suffering from a delusional syndrome known as Cotard Syndrome. Basically, to understand Cotard Syndrome, you need to understand delusion. So what is delusion? Delusion is a false form belief. So it is a false belief and the patient is firm in his or her belief. So false firm belief. Number 1 point for delusion. Second point for delusion is outkeeping with cultural and educational background. So it is outkeeping. It is away from the culture. It is away from any kind of cultural and educational background of the patient. So that is the second point of delusion. So number 1 is false and firm belief. Number 2 is it is outkeeping from the cultural and educational background of the patient. Number 3 is morbid origin. What do you mean by this terminology, morbid origin? Basically, morbid origin means it has no logic. The belief has no logic. So 3 important things I told you. Delusion means false belief, and the false belief is also a very strong, very firm belief. That is number 1. Number 2, which I told you, is it is out keeping with cultural and educational background of the patient. That means no one believes that the other society members, the patient is living in a society where others don't believe it. So the other people, like his family, his friends, or the society people, they don't believe that he or she has a special strong false belief. So that false belief is in contrary to the cultural and educational background of the patient. Another feature is morbid origin. Morbid origin, I told you, morbid means illogical, so it has no logic. So these are the three important things a delusion has. Delusions means false form belief, and the patient has a strong belief in that. Basically, this Cotard syndrome is also known as, who can tell me what is the other name of Cotard syndrome? The other name of Cotard syndrome is walking corpse syndrome. Walking corpse syndrome. So basically, this Cotard syndrome is a very rare disorder. It is a rare mental disorder, and specifically it affects the person, and which persons are morely associated with this kind of belief. So let us discuss about which persons are more associated with this kind of disorder like Cotard syndrome. So those persons who are suffering from schizophrenia, those persons who are suffering from severe depression, those persons who are suffering from bipolar disorder, those persons who are suffering from any kind of brain injury. So all these persons have greater chance of having this kind of disorder. This disorder is known as delusion of nihilism. This is known as delusion of nihilism. What is the meaning of this term nihilism? Nihilism means denying of existence. Denying of existence. So this patient may be denying the existence of certain organs that are present in our body. Like that person may deny of having heart. That person may deny of having lungs. That person may deny of having brain. So all these things are organ related denial. Another things, they may also deny that the earth exists. They may also deny that the planet earth exists. They may also deny their own children. They may also deny their own children. They may also deny their own parents. So all these things, all these are denial of existence. So nihilism means these patient may deny any organ that is present in their body. They may deny the existence of heart, existence of brain, or functioning of heart, functioning of brain. They may deny existence of earth. They may deny existence of children. They may deny existence of their own parents. So this is the delusion of nihilism. That means delusion, to deny the existence. Nihilism means denial of existence. Denial of existence. So basically, what happens, how this disease is caused? Let us go to the theories which can actually cause this disease. There are so many theories and there are so many studies that are going on, but let us discuss in details about the more useful theories. I will not talk about those theories which are useless. And basically, you can see this is a brain and you have this two small parts. These are the lower one is the fusiform face area. So this is called fusiform face area. This is a part of brain, fusiform face area. Another part is amygdala. So amygdala. So these are the two parts. One is fusiform fusiform face area. So what is this fusiform face area do? Basically this helps in facial recognition. That is known as, that is the work of fusiform face area of brain. Fusiform face area of brain helps in the facial recognition. Then what does amygdala do? Amygdala is associated with the emotion of facial recognition. For example, suppose a boy was there and in front of him he saw a girl who he loves. So first when the boy look at the girl, that is the facial recognition. He can recognize the girl, and this facial recognition is done by fusiform face area. This facial recognition is done by fusiform face area. The boy can recognize the girl, that recognize her face, and that is fusiform face area function. Next comes the function of amygdala. So what does amygdala do? Amygdala is related with emotion. Amygdala is related with emotion of the facial recognition. Emotion of the facial recognition. So the boy, as I told you, the boy loves the girl. So the love feeling, the love emotion, the romantic emotion will come in his mind. So in this way, these two are connected. In this way, these two are connected, these two small parts. So at first let me draw the circuit for you. This is the eye. So from eye the circuit is there first to this. The circuit first comes to fusiform face. From here the circuit comes to this, that is amygdala. So first from eye the circuit comes to fusiform face area, then the circuit goes to amygdala. So you can understand this is the brain circuit that is there in a normal person, and this is responsible for the facial recognition and emotion associated to it. So what happens to a person who is having Cotard syndrome? So a person who is having the Cotard syndrome, what happens? Basically this two circuit is now not connected. This two circuit is not connected. So the person who has the connection with the eye, so he saw someone, and that connection goes around here and it goes to the fusiform face area, but that connection between the fusiform face area and amygdala is not there. You can see the fusiform face area and amygdala connection is not there in that brain of the patient. So there is the person actually observed his own face. So what happens to this case? The person observed his own face and the person has no emotion. So if there is no connection between fusiform and amygdala, is there any emotion associated with it? No. So the person is without emotion. The person is without emotion. So the person looks at his own face and without emotion, and the person has lost the sense of self. The person loses the sense of self. The sense of self is lost in this person. So the person started believing that he is dead or she is dead. So you can understand now the mechanism or the theories by which Cotard delusion is caused. So what is the treatment? Basically the treatment plan is very much difficult, but we still try. So the treatment is ECT. Number one treatment is ECT, electroconvulsive therapy. Electroconvulsive therapy. This is ECT. Along with ECT, you can have three important medication which are needed. What are the three important medication? antidepressant, number 2 antipsychotics, number 2 antipsychotic, number 3 mood stabilizer, number 3 mood stabilizer. So these are the three important medication, that is pharmacological help, that is also given along with ECT treatment, electroconvulsive therapy. So this is the end of this video. If you like this video, make a thumbs up and subscribe this channel for getting many more educational videos, medical videos like this. And if you like our effort, please share this video with all your friends so that many more medical students can join our channel. And if you like this video, make a thumbs up and please write down in the comment section below if you like our channel and our videos. Thank you so much for watching. Have a nice day. Bye bye.